In tonight's cover story, a new controversial treatment for men with prostate cancer. It's called HIFU. It uses ultrasound technology, the very same science that shows pregnant women the first signs of life. Now some doctors say it may just save a life. 8 months ago, 67-year-old Gary Tosher flew with his wife to Puerto Vallarta, but it wasn't for the sunny beaches. Tosher was getting treated for prostate cancer.
When it does happen, then you really kind of take a deep breath and have all of the implications that go with that, and you start thinking about it.
Months later, Tosher, a retired pharmacist, is cancer-free. His treatment, a non-FDA-approved procedure he learned about on the internet called HIFU, short for high-intensity focused ultrasound. But because it's not approved, patients must leave the country to have it done. One of the most experienced urologists with this treatment, Dr. Scionti, is on Hilton Head Island.
Virtually every other developed country in the world has access to technology that was built right here at home.
Scionti says what sets this cancer treatment apart is that it doesn't give the side effects associated with radiation that can make a man impotent or give him urinary problems.
The very thought of having to be in a pad or a diaper or giving up our sex life is scary.
HIFU requires no actual surgery. A medical device is inserted through the rectum, where it then takes ultrasound pictures of the prostate. Once the cancer is identified, these highly focused ultrasound rays heat the tissue, killing it and the cancer. But the surrounding tissue remains intact.
It's like a smart bomb. Very, very precise, and that avoids collateral damage.
In Europe, patients studied over the past 10 years have shown remarkable results with HIFU. But regardless, there are still hundreds of doctors here in the U.S. who remain skeptical.
Many times we'll only look at data that comes out of the United States.
That data is coming. The FDA is doing clinical trials, but any move to approve HIFU is still at least 5 years away. Until then, men like Gary will have to foot the bill and travel overseas for this controversial treatment. Now, patients pay about $25,000 for the treatment, which Scionti says is expensive when you're paying it out of pocket. But if this treatment is approved, it will one day save insurance companies millions compared to radiation. As far as the FDA approval, HIFU is the only prostate cancer treatment that has been required to get this approval. And if you want to find out more, go to